General surgery abdominal trauma, Q&A management principles and frequently asked questions. Welcome to the Everything Surgery podcast. Today we ask 100 essential questions on the management of abdominal trauma based on the ATLS guidelines. Pause the video when you hear the word answer to attempt answering the question. Let's begin. Question: what is the first step in managing abdominal trauma? Answer: the initial approach centers on the airway, breathing, circulation, disability, and exposure. Primary survey, addressing immediate threats to life before any further evaluation. Question: what are the three main mechanisms of abdominal injury? Answer: the three principal mechanisms are blunt trauma, penetrating trauma such as stab or gunshot wounds, and blast injuries. Question: why is the abdomen sometimes referred to as a black box in trauma? Answer: the abdomen is called a black box because significant internal bleeding can occur without obvious external signs, making repeated examinations and a high index of suspicion essential. Question: what are the classic signs of hemorrhagic shock? Answer: classic indicators include rapid heart rate, low blood pressure, increased respiratory rate, cool and clammy skin, altered mental status, and reduced urine output. Question: what is the preferred initial fluid for resuscitation in hemorrhagic shock? Answer: the preferred fluids are warm blood products given in balanced proportions, such as red blood cells, plasma, and platelets, with limited use of crystalloid solutions. Question: what are the limitations of the abdominal examination in trauma? Answer: the abdominal examination may be unreliable due to factors such as altered mental status, spinal cord injury, or distracting injuries that can mask signs of internal damage. Question: what is the significance of a seatbelt sign on the abdomen? Answer: a seatbelt sign is a visible contusion across the abdomen and suggests a higher likelihood of internal injuries, including perforations of hollow organs and certain spinal fractures. Question: what is Kerr's sign? Answer: Kerr's sign refers to pain in the left shoulder caused by irritation of the diaphragm from internal bleeding, such as that seen with splenic injuries. Question: what is Cullen's sign? Answer: Cullen's sign is the appearance of bruising around the navel, indicative of retroperitoneal hemorrhage, as may occur with severe trauma or pancreatitis. Question: what is Gray-Turner's sign? Answer: Gray-Turner's sign is bruising along the flanks, also suggestive of retroperitoneal bleeding. Question: what is the most important initial diagnostic test for abdominal trauma? Answer: the most important initial diagnostic test is the focused assessment with sonography for trauma, which evaluates the abdomen for free fluid, suggesting bleeding. Question: what does the focused assessment with sonography for trauma evaluate? Answer: it examines four potential spaces for free fluid: the pericardial area, the right upper quadrant, the left upper quadrant, and the pelvic region. Question: what is the major advantage of the focused assessment with sonography for trauma? Answer: its speed, non-invasive nature, repeatability, and ability to be performed at the bedside during initial assessment are major advantages. Question: what is the major limitation of the focused assessment with sonography for trauma? Answer: it cannot reliably identify the source of bleeding or detect retroperitoneal, hollow organ, or diaphragmatic injuries. A negative result does not rule out significant injury. Question: when is a computed tomography scan with intravenous contrast indicated in abdominal trauma? Answer: a computed tomography scan with intravenous contrast is indicated for patients who are hemodynamically stable and have sustained blunt abdominal injury, to assess and grade organ damage and retroperitoneal involvement. Question: what is the purpose of a triple contrast computed tomography scan? Answer: triple contrast, combining oral, intravenous, and rectal contrast, was previously used for complex injuries but is now largely replaced by high-quality intravenous contrast scans alone. Question: what is the role of diagnostic peritoneal lavage in abdominal trauma? Answer: diagnostic peritoneal lavage, though largely replaced by other modalities, may be employed in unstable patients when ultrasound is inconclusive or unavailable, due to its high sensitivity to intra-abdominal bleeding. Question: what are the positive criteria for diagnostic peritoneal lavage? Answer: positive results include a high red or white blood cell count, or the presence of bile, bacteria, or food particles in the lavage sample. Question: what is the value of plain X-rays in abdominal trauma? Answer: the utility of plain X-rays is limited. However, chest X-rays may reveal diaphragmatic hernias or free air, and pelvic X-rays assist in evaluating pelvic fractures. Question: What constitutes the lap belt complex? Answer. This complex includes a specific spinal fracture, injury to hollow organs, and bruising across the abdominal wall caused by seatbelt trauma. Question. What is the most commonly injured organ in blunt abdominal trauma? Answer. The spleen is most commonly injured in blunt abdominal trauma. Question. What scale is used to grade splenic injury? Answer. The American Association for the Surgery of Trauma Organ Injury Scale, which assesses laceration depth, hematoma size, and vascular involvement, is used to grade splenic injuries. Question. What is the primary objective in managing splenic injuries? Answer. The primary aim is non-operative management in hemodynamically stable patients to preserve the spleen's immune function. Question. What does non-operative management for solid organ injury entail? Answer. It includes close monitoring in a critical care setting, strict bed rest, serial examinations of the abdomen, and repeated hemoglobin checks. Question. What is the approximate success rate of non-operative management in adults with blunt splenic injuries? Answer. Success rates are approximately 80 to 90% in appropriately selected adult patients. Question. What is the most common reason for failure of non-operative management? Answer. The most frequent cause of failure is delayed hemorrhage. Question. What role does angioembolization play in trauma? Answer. Angioembolization is used for patients who are stable but show signs of active bleeding on imaging, specifically a contrast blush on computed tomography. Question. What are the absolute indications for surgical intervention in splenic injury? Answer. The most clear-cut indication is persistent instability of vital signs despite resuscitation. Question. What is the most commonly injured organ in penetrating trauma? Answer. The liver is most frequently injured in cases of penetrating trauma. Question. What is the Pringle maneuver? Answer. The Pringle maneuver involves compressing the ligament that contains the portal vein and hepatic artery to control bleeding from the liver. Question. How should a deep liver laceration with massive hemorrhage be managed? Answer. Such injuries are managed by operative packing, intensive care resuscitation, and a planned reoperation for pack removal once the patient's condition stabilizes. Question. What is perihepatic packing? Answer. Perihepatic packing involves placing surgical pads around the liver to tamponade bleeding. Question. What is atrium syndrome? Answer. Atrium syndrome is a rare complication where surgical packs compress the inferior vena cava, leading to low blood pressure. Question. What is the most common cause of death after severe liver trauma? Answer. The leading cause of death in these cases is coagulopathy. Question. What is the most common renal injury from blunt trauma? Answer. Renal contusion is the most common form of injury to the kidney following blunt trauma. Question. What is an absolute indication for renal exploration? Answer. The discovery of an expanding or pulsatile retroperitoneal hematoma during surgery is an absolute indication for renal exploration. Question. What is the key diagnostic test for suspected ureteral injury? Answer. A computed tomography scan with delayed imaging is essential to detect leakage of contrast from the ureter. Question. What is the most common cause of hollow organ injury in blunt trauma? Answer. Hollow organ injury most often results from shearing or crushing forces, such as those encountered in motor vehicle accidents. Question. Which part of the small bowel is most frequently injured? Answer. The proximal jejunum, near the ligament of Treitz, is the most commonly affected segment. Question. What is the most specific computed tomography finding for bowel injury? Answer. The most specific imaging feature is air outside the bowel or leakage of oral contrast, which indicates perforation. Question. What are other computed tomography signs of bowel injury? Answer. Additional clues include thickening of the bowel wall, abnormal enhancement or discontinuity, and the presence of fluid in the absence of solid organ injury. Question. Why are hollow organ injuries often diagnosed late? Answer. These injuries may not cause immediate physiological instability, and initial examinations and imaging can appear normal. Question. What is the treatment for a small bowel perforation? Answer. Surgery is required, typically involving exploratory laparotomy and either repair or removal of the affected segment, followed by reconnection of the bowel. Question. What part of the colon is most commonly injured? Answer. The transverse colon and the rectosigmoid junction are most frequently injured due to their fixed positions in the abdomen. Question. What is the traditional management for a destructive colon injury in high-risk patients? Answer. The traditional approach involves removal of the damaged section, creation of a colostomy, and a planned second operation for restoration of bowel continuity. Question: when is primary repair of colon injury considered? Answer: primary repair may be offered to stable patients with minimal contamination, good blood supply, and no significant additional health problems. Question: what is a duodenal hematoma? Answer: a duodenal hematoma is a blunt injury causing obstruction, which can often be managed non-surgically with bowel rest and nutritional support. Question: what is the double bubble sign on X-ray? Answer: this finding suggests obstruction due to a duodenal hematoma. Question: what role does the Whipple procedure play in trauma? Answer: the Whipple procedure is sometimes used as a last resort for irreparable injuries to the pancreas and duodenum. Question: what is the mortality rate for abdominal aortic injury? Answer: the mortality rate is extremely high, with most patients succumbing before reaching medical care. Question: what is the key to managing a retroperitoneal hematoma found during surgery? Answer: the main principle is to leave the hematoma undisturbed unless it is expanding, pulsatile, or ruptured. Question: how are the zones of retroperitoneal hematomas classified? Answer: Zone 1 includes central structures such as the aorta and pancreas. Zone 2 includes the flanks with kidneys and ureters, and Zone 3 encompasses the pelvis and iliac vessels. Question: when should a central retroperitoneal hematoma be explored? Answer: exploration is generally warranted after both blunt and penetrating trauma due to the high risk of major vascular injury. Question: when should a flank hematoma be explored? Answer: flank hematomas require exploration if expanding or resulting from penetrating trauma. Stable, non-expanding hematomas from blunt trauma often do not need intervention. Question: which vessel is most commonly injured in pelvic fractures? Answer: bleeding from the venous plexus is more common than arterial injury in pelvic fractures. Question: how are stable pelvic fractures with bleeding managed? Answer: the primary treatment for arterial bleeding in stable pelvic fractures is angioembolization. Question: what is a traumatic abdominal wall hernia? Answer: this rare injury involves the protrusion of abdominal contents through a disruption in the muscle and fascia, without a break in the skin. Question: which side is most commonly affected by diaphragmatic injury? Answer: the left side is most commonly injured because the liver protects the right hemidiaphragm. Question: how does a diaphragmatic injury present? Answer: diaphragmatic injuries are often hidden. Chest X-ray may show the nasogastric tube in the chest, an unclear diaphragm, or herniation of abdominal organs. Question: what is the best test for diagnosing diaphragmatic injury? Answer: computed tomography is the preferred method, looking for the collar sign, which indicates constriction of abdominal viscera at the site of injury. Question: why must all diaphragmatic injuries be repaired? Answer: repair is vital to prevent future herniation and strangulation of abdominal organs. Question: what is the standard management for a gunshot wound to the abdomen? Answer: mandatory exploratory surgery is required because of the high likelihood of internal injury. Question: what is selective non-operative management for abdominal gunshot wounds? Answer: selective non-operative management is an approach used for stable, symptom-free patients where imaging shows no significant injury. Question: how are stab wounds to the abdomen managed? Answer: local wound exploration determines whether the abdominal fascia has been penetrated. If penetration is confirmed or uncertain, further evaluation is necessary using serial examinations or diagnostic imaging. Question: what is the role of triple contrast computed tomography in penetrating trauma? Answer: triple contrast computed tomography is sometimes used to evaluate flank and back wounds for retroperitoneal injury. Question: how is a tangential gunshot wound managed? Answer: computed tomography is used to assess for through and through injury or concealed penetration of the peritoneum. Question: what is damage control surgery in trauma? Answer: damage control laparotomy is a staged surgical approach involving abbreviated initial surgery, intensive care resuscitation, and subsequent definitive repair. Question: what are the indications for damage control laparotomy? Answer: indications include physiologic exhaustion, such as severe acidosis, hypothermia, or coagulopathy, as well as complex patterns of injury. Question: what are the initial steps in a damage control laparotomy? Answer: the steps include controlling bleeding, addressing contamination, and performing temporary closure of the abdomen. Question: what are the methods for temporary abdominal closure? Answer: Temporary closure methods include sterile bag suture to the skin and vacuum-assisted closure devices. Question: what is abdominal compartment syndrome? Answer: abdominal compartment syndrome is elevated intra-abdominal pressure that leads to new organ dysfunction. Question: what are the signs of abdominal compartment syndrome? Answer: signs include increased airway pressures, low blood pressure, reduced urine output, and a tense abdomen. Question: what is the definitive treatment for abdominal compartment syndrome? Answer: the definitive intervention is emergency decompressive surgery. Question: what is the most common complication after removal of the spleen? Answer: the most frequent complication is an elevated platelet count, but the most serious is overwhelming infection from certain bacteria. Question: which pathogens cause overwhelming post-splenectomy infection? Answer: Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenzae type B are the typical bacteria involved. Question: how can overwhelming post-splenectomy infection be prevented? Answer: prevention includes vaccination before discharge and lifelong antibiotic prophylaxis. Question: what is a bile leak after liver injury? Answer: a bile leak is a recognized complication, commonly managed with endoscopic procedures and stent placement. Question: what is a pancreatic fistula? Answer: a pancreatic fistula is persistent drainage with high levels of amylase, typically managed conservatively. Question: what is the most common source of bleeding after surgery? Answer: failure of vessel ligation or inadequate hemostasis is the most frequent cause. Question: what is an enterocutaneous fistula? Answer: an enterocutaneous fistula is an abnormal connection between the bowel and the skin, managed by bowel rest, nutritional support, and delayed surgery. Question: what is the most common cause of death after initial trauma resuscitation? Answer: the leading causes are sepsis and multi-organ failure. Question: what injury is most commonly associated with a lumbar spine fracture from seatbelt trauma? Answer: small bowel injury is most often associated. Question: what is the hanging spleen sign on computed tomography? Answer: this sign refers to the spleen appearing unattached due to complete disruption of its vascular pedicle. Question: what is the sentinel clot sign? Answer: a sentinel clot is a dense clot seen near the source of bleeding on imaging. Question: what is the role of magnetic resonance imaging in abdominal trauma? Answer: magnetic resonance imaging is rarely used acutely but can assess injuries to the bile ducts and pancreas. Question: what is a wandering spleen? Answer: a wandering spleen is a spleen that moves freely due to lax ligaments and is prone to twisting and loss of blood supply. Question: how is a pancreatic injury with main duct disruption treated? Answer: the typical treatment is removal of the distal pancreas and spleen for injuries to the body or tail of the pancreas. Question: what is the most specific sign for a bladder injury? Answer: leakage of contrast on computed tomography cystogram is the most specific finding. Question: when is placement of a urinary catheter contraindicated in trauma? Answer: it is contraindicated if blood is seen at the urethral opening or if the prostate is high riding on examination, which may indicate urethral injury. Question: what is decompressive laparotomy? Answer: decompressive laparotomy is emergency surgery performed solely to relieve abdominal compartment syndrome. Question: what is the most common iatrogenic injury during damage control procedures? Answer: injury to the bowel during temporary closure or re-exploration is most frequent. Question: what is the second hit phenomenon in trauma? Answer: the second hit phenomenon refers to a scenario where initial trauma primes the immune system, making the patient susceptible to an exaggerated response to subsequent events. Question: what is the role of interventional radiology in trauma care? Answer: interventional radiology is essential for controlling bleeding, draining abscesses, and stenting injuries. Question: what is the death triangle in trauma resuscitation? Answer: the death triangle consists of hypothermia, acidosis, and coagulopathy, which create a cycle leading to poor outcomes if not interrupted. Question: what is the trauma and injury severity score? Answer: the trauma and injury severity score is a statistical tool that predicts the probability of survival by analyzing the injury mechanism, physiological data, and anatomical injuries. Question: what is the most common missed injury on initial computed tomography scan? Answer: injuries to the diaphragm and hollow organs are most frequently missed. Question: how should a non-expanding retroperitoneal hematoma from a renal injury found during surgery be managed? Answer: such hematomas should be left undisturbed. Question: What is the key principle in managing a patient who becomes unstable during non-operative management? Answer. Immediate transition to surgery or angioembolization is essential if instability develops. Question. What is the lethal triad of trauma? Answer. The lethal triad refers to hypothermia, acidosis, and coagulopathy. Question. What is the ultimate goal in abdominal trauma management? Answer. The ultimate goal is to stop bleeding, control contamination, and resuscitate the patient according to their physiological state rather than solely on anatomical injuries. That's it. Thanks for tuning into today's episode. If you have any questions, leave it in the comment section. If there are any topics you are interested in seeing on this channel, state it in the comment section. If you enjoy the video, remember to like, share, and subscribe. It's the Everything Surgery Podcast. Dissect the extraordinary.